Welcome to the topic Stem Cell Transplantation in the Haematology module. By the end of this topic, you should be able to describe stem cell transplantation, outline the classifications of stem cell transplantation, explain the method of performing this procedure, describe the indications and contraindications, explain the adverse effects or side effects of stem cell transplantation, and discuss the complications of stem cell transplantation. Let's get started. Stem cell transplantation is a medical treatment that replaces bone marrow with healthy cells. It can be classified into two types, which is the autologous and allogenic transplantation. Autologous stem cell transplantation involves own blood-forming stem cells. The stem cells are collected and the patient then is treated with high doses of chemotherapy. Chemotherapy will cause the cancer cells and healthy cells to die. After this, the collected stem cells are put back into the bloodstream so that the bone marrow can produce new blood cells. In allogenic stem cell transplantation, the person's stem cells are replaced with new healthy stem cells. The new cells come from a donor or from donated umbilical cord blood. Chemotherapy or combination of chemotherapy and radiation therapy will be given before the transplant. The respective therapy kills the cancer cells or stops the patient's immune system from working like it normally does, or both. The new stem cells are then added to the patient's bloodstream through a tube. The procedure is like a blood transfusion. This image illustrates the process of autologous transplantation. We begin with stem cells which are collected from the patient's bone marrow or blood. The bone marrow or blood is processed in the lab to purify and concentrate the stem cells. Blood or bone marrow is frozen to preserve it. High dose of chemotherapy and or radiation therapy is given to the patient. And finally, the thawed stem cells are reinfused into the patient. There are many functions of stem cell transplantation. First, stem cell transplantation eliminates a bone marrow infiltrative process such as leukemia. It can also be used to correct congenital immunodeficiency disorders and allow patients with cancer to receive high doses of chemotherapy. Stem cell transplantations help in producing normal red cells in hemoglobinopathies and corrective enzymes in storage disorders. It also mediates tissue repair in epidermolysis bullosa. Stem cell transplantation can be indicated in malignant diseases and non-malignant diseases. The example of malignant diseases include AML, ALL, CML, CLL, myelodysplastic syndromes, myeloproliferative syndromes, lymphomas, myelomas, amyloidosis, Waldenstrom macroglobulinemia, hairy cell leukemia, and selected solid tumors as well as neuroblastoma. Non-malignant diseases that can be treated with stem cell transplantation are acquired aplastic anemia, congenital pure red cell aplasia, Fanconi anemia, thalassemia, sickle cell anemia, paroxysmal nocturnal hemoglobinuria, severe combined immunodeficiency, Wiskott-Aldrich, congenital leukocyte dysfunction, and selected autoimmune diseases. The contraindications of stem cell transplantation are systemic or uncontrolled infection, poor functional capacity, and organ damage such as cardiac, renal, hepatic, and pulmonary failure, psychological factors affecting the ability to adhere to treatment and follow-up, and myelodysplasia on bone marrow examination. Stem cell transplantation are associated with some complications. The complications include infections which could be acute or chronic, graft versus host disease, bleeding, and anemia. Hepatic veno-occlusive disease can happen within 3 weeks of transplant. Graft failure, relapse of the disease, and second cancer may be the complications of stem cell transplantation. In summary, stem cell transplantation is a medical treatment that replaces the bone marrow with healthy cells. The types can be largely divided into autologous and allogenic transplant. The process of stem cell transplantation starts with collecting the replacement stem cells, then preparation of the patient receiving, transplant process, and lastly, recovery. The indications include hematological malignancies and certain non-malignant conditions. Stem cell transplantation has both acute and chronic complications. We have come to the end of this topic. Thank you.